Good morning, everyone. I'm Joan Mower. I'm the Director of Training and Development for the U.S. Agency for Global Media. We run Voice of America, which luckily is broadcast in Mongolia. We hope you listen to us. We are actually part of the U.S. government. We are funded by the American taxpayer. And we're delighted to be here in Mongolia, which has always been for us a very welcoming country and a country where we're very interested in the media. In part, your location makes you extremely important. And of course, there's many Mongolians who live and work in America. So we're very happy to talk to you here about some of the issues involving journalism. Today, we're going to look at staying safe during the COVID-19 pandemic. Journalists are, of course, the frontline defense of information and news. Your role, obviously, is incredibly important, and you're the #1 way that people get their information about COVID-19. You are the messenger for the people. You have a public duty. So let's go through some of the issues that, some of the precautions that you can take. This pandemic is very scary for everyone, but it is particularly scary for journalists because you're on the front lines, almost like the medical professionals. So just would like to draw your attention to 2 websites listed at the bottom here. One is the Committee to Protect Journalists, which is a non-governmental organization in New York. And the second is the International Center for Journalists, icfj.org. Both of these websites have numerous resources for journalists about COVID, how to stay safe, how to protect yourself, how to do a good job of reporting, what you should know about the disease, and how you should go about your business. I will just add that in my agency, the Voice of America, a number of people have tested positive for COVID. Currently, the people who go into our office are required to wear face masks at all times. We have to practice social distancing, and numerous numbers of us are working at home, so as to minimize the number of people who are actually in the building at any time. And those who go off on assignment are given equipment to protect themselves, because it's a disease that's very fast spreading, and it's also a disease that's very contagious. So we all know that coronavirus was declared a pandemic by the World Health Organization on March 11th, nearly 2 months ago. And the number of cases continues to rise. The challenge for journalists with COVID is that the scientific information about the disease is limited. While scientists are making a lot of progress quickly, there are many unanswered questions, and this makes it difficult for reporters. For instance, one question is, why are there so few cases of death in Mongolia? Is it because the country is diverse? Sorry, not diverse, but spread out. One theory is that when people live very close together, it's easier to contact the disease, as well as to the virility. The disease is much more serious, possibly. So these are questions that doctors are trying to answer, but it makes it hard for journalists to do their jobs when they really don't know all the facts, and no one does. So here are some of the things that journalists have to do while they're trying to do their jobs. #1, they have to travel. #2, they have to interview people. And #3, they're frequently in tight locations, in close locations. They're going into places like hospitals. They're going into nursing care facilities. They're interviewing people. So these put you at risk just by doing your job. Just to make sure you're up to date on all the latest information and what you should and shouldn't be doing, I've listed the name, number, and the website for the World Health Organization person in Mongolia. You do have a regional office there, and we always encourage our journalists to go to the source of information before they even start reporting a story, so that they have the most up-to-date information. So let's talk about staying safe in the field. The first is that much of your travel will probably be domestic based at this point. International travel, as you know, has been way cut down. In fact, I was reading that flights coming into Mongolia are only allowed to bring Mongolians back to your country. You don't have flights leaving the country, and you don't have foreigners coming into the country. So only Mongolians are coming into your country at this point. Secondly, assignments are highly likely to change or be canceled. This can be very frustrating for all journalists. You've spent a lot of time organizing your interviews, organizing your day, getting people on the phone, and all of a sudden something's canceled. So you really have to just try to be flexible. It's difficult when there's a lot of stress in the air, but flexibility is a key. Third, please discuss all of your plans with your bosses. We at Voice of America have been encouraged, well, not encouraged, required to tell our superiors what we're doing every day, what our plans are. If we are going anywhere, we're supposed to let people know. And that's to protect not just you, but to protect others around you. So when I told you we do have COVID cases at the Voice of America, and as soon as someone tested, they were required to quarantine, and then anyone who came in contact with them was also required to be in quarantine. And the fourth is to be ready to be grounded or to go into self-isolation. And I can think of nothing worse for a journalist than to be in self-isolation, because the nature of your job is to actually get out and to interview people and to see people. And being grounded or being self-isolated is not a happy place. But again, flexibility is the watchword. So this is common sense, and I'm sure your government officials are putting out this word. The Centers for Disease Control, which is our agency that monitors health, they also have a very good website, which I've listed here. They have said 3 groups of people fall into categories that are high risk: older people, people with underlying health conditions like diabetes or overweight or smoke, heart conditions, and pregnant women. So if you fall into any of these categories, the recommendation is that you don't go out and don't spend a lot of time in environments where you might catch this disease. Let's talk for a minute about something that is really important for journalists, almost as much as for health officials, and that is your own psychological well-being. All of us are under a lot of stress as a result of this pandemic. We haven't been able to see our friends. More seriously, many people have lost their jobs. Their livelihoods have been compromised. They worked in a restaurant. They can't serve people anymore except for takeout. So this has been really hard on so many people. And it's particularly hard on journalists who often have to go out into environments where they encounter danger. And one of the things that we recommend is that you really have an honest discussion with your family, because while you may not be scared, it's probably likely that your family is very worried for you if you are actually a reporter on the front lines. So the recommendation is that you talk with your family and bring in a medical professional if you have to. Have a doctor, have a psychiatrist, have a psychologist, talk to your wife, talk to your husband, talk to your children to let them know what the risks are and what the risks are not. Consider the potential psychological impact of reporting from an area with COVID. And by this, what we mean is, look at this as actually a story. People are suffering psychologically as well as spiritually, economically. And again, this is a story that is having an impact on all of us, and it's something that shouldn't be ignored. Finally, I want to draw your attention to an organization called the DART Center for Journalism and Trauma. And I've listed the site below. I encourage you to go to it. It's a fantastic organization based in the state of Washington. And they have spent a lot of time and many years looking at traumas, psychological trauma that journalists often face when they encounter death, if they've had to cover a tragedy. Journalists, as well as people in the military, as well as doctors, can suffer from post-traumatic stress disorder. And it's now being analyzed and evaluated at a much greater rate than before. So these are the rules that you're, I'm sure, reporting to everyone, just to reinforce them, because repetition is the way we learn. Social and physical distancing. In America, we say 6 feet. What in European terms, that's about 2 meters. And finally, if you are actually going to a densely populated area, such as a healthcare facility, a morgue, an animal market, a farm, it's really worth checking out the hygiene situation before you go. Make sure you bring your gel with you, but talking to people to see, talking to the owners, the managers, to see what they're actually doing about hygiene. And if you have any issues or questions, don't visit it. Nothing is worth your life as a journalist. And finally, if you're showing symptoms or you're around people who are showing symptoms, be very careful. Again, recommendations: wash your hands thoroughly, use antibacterial gel, don't substitute regular hand washing by using hand sanitizer. So we all carry sanitizers here in America, but we also wash our hands. Again, just some more precautions that you should be taking. Don't touch your face and nose, wear a mask if necessary, don't shake hands, hug, kiss, and avoid drinking from cups, crockery, or cutlery that may have come in contact with other people. This is a really interesting slide, I think, because it underscores that this virus apparently can live on surfaces. So what we recommend for journalists is don't wear any additional jewelry or watches that could pick up COVID and live on those surfaces. Clean your glasses on a regular basis. Wash your clothes with detergent after any assignment, and avoid traveling on public transportation at rush hour. Referring back again to the issues of psychological toll that this is taking on journalists. Really try to take care of yourself. Self-care is the most important, and that means get your sleep. Try not to stress out. Rest. If you're tired, you're going to make mistakes, and that's not going to help anyone. Of course, if you develop any symptoms, immediately self-isolate and try to get a test. And finally, and this is an interesting one, but your health, make sure you eat cooked meat and cooked eggs. One of the things that we noticed, and this is not related to COVID, but when we had the swine flu and the avian flu, one of the ways that this disease was, these previous diseases were carried was through uncooked meat and eggs. Equipment safety. Use directional microphones if you're broadcasting. Learn to cover and how to clean your equipment. You can probably find guidance on YouTube, or you can find guidance from the World Health Organization. And decontaminate all your equipment after you've gone on assignment. Use wipes that have antimicrobial gel on them. But just make sure you have a very clean work environment when you're in touch with other people. Again, just more to-dos, more guidance on equipment, your vehicle, how you can better protect yourself from getting this virus. The question of personal protective equipment has been a huge one in the United States. And by PPE, we refer to coveralls, clothes that cover the clothes that you're wearing, a protective gown of some kind, aprons, gloves, and disposable shoe covers. And this became a huge issue in the United States because at the beginning, there was not enough PPE for the healthcare workers. So journalists also, I'm sure you've seen pictures, journalists are also using PPE when they go into any environment that might be contaminated, such as a hospital or a nursing home. So these are some guidelines for using PPE. And we've been at Voice of America, our bosses have given PPE to people who are going to be going into these environments. So in many cases, they're required. So that concludes some of the safety tips that journalists should be taking to protect themselves. Don't be a Lone Ranger. A dead journalist is not a good journalist. So your safety is the most important thing for you. And good luck and keep up the good work. Thank you so much.